Dr. Aparna Bole chairs the American Academy of Pediatrics Council on Environmental Health. She is the medical director of community integration at Rainbow Babies and Children's Hospital in Cleveland, and she is also an associate professor of pediatrics at Case Western Reserve University School of Medicine. Aparna, welcome to the show.
Thank you. It's such a pleasure to be here.
I have to tell you, Aparna, this interview is really personal for me. Years ago, I joined a group of local doctors advocating against a coal-fired cement plant that was proposed for a sensitive area of Wilmington. We had a lot of support in the community, but many other people came out and said, stay in your lane. Doctors don't have any business talking about pollution or climate change. Is that something you've heard? And if so, how do you respond?
Thanks for sharing that. Yeah, I do still hear that sometimes. Like our lane is a clinical environment. Maybe it's at the bedside. Maybe it's with a patient visit or at the hospital. But, I'm a primary care doctor, and we know that the majority of determinants that influence our patients' well-being happen outside our clinic walls. And so if we confine ourselves to that 10 or 15-minute interaction, write a script, bye, see you later, we're really not doing justice to our commitment to advocate for the total health and well-being of children. So I feel like it's absolutely our lane to be concerned about environmental, social, and other determinants of health that come into play for our patients.
And climate affects children's health in so many ways. It almost seems like it's impossible to keep track. What effects of climate change would you say have the most importance right now when we're thinking about children's health?
I think it's important to remember that climate change is affecting children right here, right now in our own backyards. And you offered some examples of, for example, extreme weather events, wildfires. I live in Cleveland. I'm from Portland, Oregon, and the pictures and accounts of poor air quality in my home state have been really hard to bear. And I know children's health is suffering from that poor air quality. Here in Ohio, air quality is an issue too, with higher surface ozone concentrations. We have longer and more intense aeroallergen seasons, kind of a double whammy for our kids with asthma. More intense heat waves, which are risky for pregnant women, affect birth outcomes, affect our youngest patients, our student athletes. We're also seeing changing patterns of infectious disease, especially those carried by like mosquitoes and ticks, changing growing zones and food security issues, water quality issues here in my state in Ohio. These extreme precipitation events are causing runoff that damages water quality in Lake Erie, both for recreation and for drinking. So there are a number of really immediate health effects that we're seeing play out right here and now in our backyards.
And COVID-19 itself could be called an environmental disease, right? If humans weren't encroaching so much on wild habitats, we may never have come into contact with this virus. Do you think we'll see more of these kinds of zoonotic infections?
I think there's a couple of ways that we can think about COVID in sort of an environmental lens. Certainly, as you point out, the interaction between humans and wildlife and sort of the erosion of some of those boundaries and some of our mismanagement of wildlife and ecosystems increases the risk of those zoonotic infections or those diseases that sort of jump from animals to human beings. And we've seen that in the past. I imagine we'll see it more in the future. Also, we know that issues like air quality are part and parcel of what contribute to COVID outcomes. And so we know that environmental exposures are heightening some of the disparities that we're seeing with COVID outcomes today.
And I think it gets to the question of what can we do to try to limit the effects of climate change. I actually try to bike to work because I'm in Philadelphia. It's a relatively flat city. So that's kind of one thing I consciously think of when I'm biking, that I'm not putting pollutants in the air and that I'm trying to preserve the environment on my daily commute. Are there things that you do in your life or that you recommend patients do in their lives to try to prevent these effects from climate change?
I really appreciate that question because I think when we hear about extreme weather events and storms and wildfires, it can feel like this huge problem, and it can be hard to really ground ourselves in hope and in solutions. But actually, I feel so hopeful because, number one, climate solutions are child health solutions. When we accelerate our transition to clean energy, when we preserve clean air, when we have sustainable, vibrant, inclusive cities that support different ways of getting around, safe places places for kids to play, when we have safer, more sustainable food systems, like all of those things have immediate child health benefits and also are good for the planet. So some things that we can do and that I do, there are a lot of different dimensions. One, you pointed out in our individual actions, we can have an impact as an individual in the choices we make, like you do in biking, but also because we're examples as pediatricians to many people in our communities. We also are very powerful advocates. We know that health voices and health messaging about climate change and public health impacts are really important because, unfortunately, the issue has become a little bit politicized, and really cutting across that politicization with health voices and really focusing on public health is a way to really speak to diverse audiences and inspire action. And the other thing I'll say is that there are a lot of things we can do at the bedside, some of which we already do in our clinical practice with our patients. One is to connect the dots for patients between environmental determinants of health and what they're experiencing in their lives. I think it's really important for parents to understand what's happening with air quality and allergy seasons, for example, if I'm seeing that kid with asthma. There are other things as well. Active transportation is really healthy for kids. It can build community, it can get them moving, it's good for the planet, good for families. More plant forward diets can be really healthy options for kids and for families, and also great for the planet, can also be great for your bottom line if you're a family that's managing a tight food budget. So there's a lot that we can be doing at the bedside. And the other thing I would say about our clinical practice is the way we run our practices and the way we run our hospitals. We contribute to climate change, and we're also important components of climate resilience in communities that are hit by disasters, for example. So much that we can be doing. I think we have a lot more power than sometimes we realize to act on climate, and all of those solutions have immediate child health benefits.
And can we dive a little deeper into maybe what we can do in the workplace to help with climate change? Because I think you brought up an interesting point, and I didn't know this until I was preparing for this interview, but around 10% of U.S. greenhouse gas emissions actually come from healthcare work that we provide. I think of during this pandemic when I'm wearing a disposable mask, that's adding to waste in the environment. So are there actionable things pediatricians can advocate for in their workspaces to kind of help, again, with decreasing the effects of climate change?
That's right. I mean, if the US healthcare sector were a country and we stacked up our greenhouse gas emissions against other countries in the world, we'd be a top emitter compared to whole countries. And our mission is all about preserving health and doing no harm. So how can we align our operations with that in terms of our environmental footprint? Really, in healthcare, we have a number of opportunities. It's about the energy that we use in our buildings, where we get our energy from. Our transportation footprint is important, and our purchasing in a lot of different ways is important. The good news is when you think about energy efficiency, it's not only great for the planet, it also is good for the bottom line. And in an environment where we're always trying to operate more efficiently, this is a way of operating more efficiently. It doesn't affect staffing ratios or negatively affect patient care issues at all. It's a win-win. We save dollars, we help the planet. In the United States, the average commercial building wastes a significant proportion of the energy it consumes. So simply by plugging up those wasteful energy uses, we can save money and do something good for the planet. We can also be really powerful purchasers of renewable energy. An increasing number of hospitals around the country are making bold climate commitments around energy efficiency as well as purchasing renewable energy to help sort of build and bolster those markets around the country. What we purchase is really important too. Where do our goods come from? How do we build our buildings? What goes in them? When we plan our menus, are we looking at more sustainably sourced food? Decreasing red meat on our menus can be really impactful as well. The way we run our operating rooms, waste anesthetic gases have an enormous climate impact, but reducing that also helps our bottom line. So it depends sort of on the setting where we practice, where those opportunities might be with operations. They can come from hospital operations. I offered a few examples of those. There are also many in practices. Energy efficiency applies in outpatient practices as well, and energy sourcing. There can be some important transportation incentives that we provide to our employees, whether a hospital or a practice, to encourage alternatives to single car commuting to work. And we know those incentives, they work and they're good for people's health too. So there are a number of things we can do in operating our buildings. And then also I would say that thinking about, as a society and as a healthcare system, investing more in preventive care and wellness itself is a climate solution. The more we're engaged in that more downstream sick care and sort of fee-for-service healthcare and not investing in prevention, we are sort of skewing our practice towards a more heavily resourced downstream form of sick care, but we're also not doing enough to invest in prevention. So we talk a lot about the importance of prevention and well care and investing sort of upstream in children's health. That's both a health solution and a climate solution.
My mind is blown right there. We talk about preventive care all the time, but I've never thought of it before as something that we can do to improve our climate impact as well. It's kind of a virtuous circle. I love that.
It's a win-win for sure.
Oh my gosh. We talk a lot here about social determinants of health. Is climate a social determinant? And are there ways the environment reinforces health inequities for our patients?
Yes, and I'm really glad you asked that. To me, social and environmental determinants of health are so intertwined as to really be almost indistinguishable. When I say social determinants of health, I mean social and environmental determinants of health. In the United States, race is the best predictor of proximity to environmental health hazards. Clean air is no exception to that. When we think about inequitable impacts of climate change on human health, it is not only children in general who are disproportionately affected, but children in historically marginalized and discriminated against communities who are disproportionately affected. So climate change exacerbates health inequities. I consider climate change as one of those environmental/social determinants of health that is so important in determining children's and families' and communities' well-being. And moreover, climate solutions are not only child health solutions, they're also health equity solutions. When we act on climate, we're advancing health equity because of those disproportionate impacts that I just talked about.
So, Aparna, I was curious if you have any tips and tricks about how to talk to children about climate change, and do you think that this is something that we should be doing at our well child checks when we have children coming to visit us for matters about their health?
Thank you so much for that question. I think we hear so much from young people about a sense of anxiety and even dread when they see what's unfolding on the news or even in their own backyards. And depending on a child's age, it can be challenging to know how to approach the issue. So, yeah, I think there are a few things that we can do ourselves and help our parents and families we work with who have questions about talking about what seems like a really big and hard to understand topic depending on the child's age. I would say, first of all, I think it's really important to be truthful with children, no matter what their age, and also to be hopeful and to be honest about what our opportunities are to seek and implement climate solutions. That's what I do with my own children who are worried. They're 6 and 9 years old, and they ask me questions about this. And I acknowledge their concerns. I'm honest and truthful about the things they're seeing unfold that are related to climate change. And then I start talking about solutions that we can implement as a family and as a society, and what can we do to advocate for those solutions and put them into place ourselves. And I think that's something that can be adjusted sort of by age group, depending on the child's capacity to really process that. But even very young children can understand if we frame our conversations sort of in that way. And the other thing I would say is that we're seeing pretty young children, teens, preteens even, who are themselves climate leaders. So I'd be remiss if I didn't point that out. I'm really grateful for that youth leadership and the level of sophistication of understanding around the links between climate change, health equity, and justice, and what we need to do about it is pretty remarkable and profound. So I think kids have a great capacity both to understand and to lead, to themselves be educators of their peers, of their parents, of their teachers, of their communities. So I think talking to kids about climate change is really important, and feeling like we're equipped to talk to parents about how to do that can be really helpful for us as pediatricians.
We have learned so much from you today, and I know there are changes that I'm ready to make right now after just having listened to you. But before you go, we always like our guests to share one takeaway that they want to be sure listeners hear. So what would you say your takeaway is?
I'd like to offer 3 brief ones if I could. One is that climate change and clean air are related to so many of the pressing chronic health issues we deal with in pediatrics, whether birth outcomes, school readiness, asthma, obesity, mental health issues. And climate health solutions are solutions to those chronic health issues. They also are health equity solutions. When it comes to clean air, vibrant and inclusive cities, and safe and sustainable food systems, those have immediate benefits to children and the planet. And finally, I hope pediatricians will remember that we are powerful advocates, messengers, examples, and educators about climate action as a child health imperative. I really believe we can instill hope and a sense of activated urgency right here and now to accelerate bold climate solutions.
Thank you so much for talking with us today, Aparna. To learn more about Dr. Aparna Bole and environmental health, visit us at aap.org/podcast.